Hello, and welcome to today's Take 10 webinar on men's health, brought to you by Premise Health. My name is Ashley Onscott, and I am a fitness services manager with Premise Health. I have my master's in exercise science and health promotion, as well as my MBA in healthcare management. And after more than 20 years in the fitness industry, I am very excited to be discussing men's health with you today. So thank you for taking the time to join me. Today, we will be looking at some statistics and discussing how they relate to three key aspects of men's health, including heart disease, mental health, and muscle building. If all goes according to plan, we will all leave here with more knowledge on these topics, as well as actionable steps that we can get started on, well, later today. Here we see some very important statistics, including over 71% of men do not meet federal physical activity guidelines for aerobic and muscle strengthening. Over 50% have hypertension, and over 41% have obesity. Close to 40% have had 5 or more drinks in one day at least once in the past year. Close to 14% are in, quote, fair or poor health, and just over 13% currently smoke cigarettes. When we look at these statistics, we can see how they all relate to our topics of heart disease, mental health, and muscle building. For example, we have an increased risk for heart disease if we have hypertension or obesity. We also have an increased risk for heart disease if we smoke and do not meet our physical activity guidelines. We can also look at it from the point of view of mental health. If we're not caring for our mental health, then we may be more inclined to consume alcohol. Or if we have high levels of stress, that may raise our blood pressure. However, if we're making mental health a priority, then we might feel more motivated to meet our physical activity guidelines and make healthy choices with our nutrition, both of which will have a positive impact on our risk for heart disease. So let's take a closer look at heart disease. Heart disease is the leading cause of death among men, and this map from the CDC illustrates heart disease deaths across the US. If we were to sum it all up, it's about 1 in every 4 deaths among US men are attributed to heart disease. While this is not good news, there are some actionable steps we can take to decrease our risk. For example, we can attend our annual checkups with our medical provider. These annual checkups help us stay on top of our preventative screenings, and they pave the way for referrals to other providers. We can enjoy a nutritious diet with plenty of vegetables. We can sit less or move more. Now, both of these will help us meet those physical activity guidelines. Avoiding smoking and secondhand smoke, as well as limiting alcohol consumption and managing stress, all will help us care for our mental health. So let's talk a little bit more about mental health. Here we see some important statistics that affect our mental health, including 6 million men suffer from depression each year, and 49% of men feel more depressed than they admit. While many men are suffering from depression, they are less likely to seek help than women. This is another reason why those annual checkups with our medical providers are so important, because when we're suffering from depression, anxiety, or anything else that may be affecting our mental health, we can mention it to our providers and discuss whether a referral to a mental health professional might be the right choice. We also see on this slide that 6 out of 10 men experience at least one trauma in their lives. These traumas can absolutely take a toll on our mental health, so it's important that we seek help. In addition to talking to our medical providers at our annual checkups and following up on referrals, we can take action each day to care for our mental health. We can do this by engaging in meditation or meditation in motion, such as enjoying a walk outdoors and taking in the environment with our 5 senses. or even engaging in any form of movement that's going to enhance our mind-body connection. Essentially, anytime we move and we're giving our full attention to our movement, it becomes meditation in motion. We often think of meditation in motion as being yoga, Pilates, or stretching, but truly meditation in motion can be accomplished while we're out for a bike ride or lifting weights and really focusing on the muscles that we're working. On a side note, meditation in motion can also help us meet those physical activity guidelines and lower our risk for heart disease. Social connections are so important for our mental health, and these can include movement. We can think about joining a sports team or walking with a friend at lunch, maybe participating in a virtual or in-person class, or even joining a webinar. So thank you for joining today. We can also think about fueling for success when it comes to mental health. This means making mindful nutrition choices. These choices will provide us with energy for the long haul. These are things such as fueling with lean proteins, enjoying a rainbow of vegetables, and staying hydrated, all of which help us feel better mentally and physically. And when we feel better physically and mentally, we're more likely to meet those physical activity guidelines, and we may even focus on other goals such as muscle building. So let's talk a little about muscle building. So muscle building is a topic that comes up quite frequently, especially when we're thinking about building muscle as we age and how this relates to hormones. According to the American Council on Exercise, anabolic steroids such as testosterone, which is naturally produced in the body, are essential for building muscle and increasing strength. This is a concept that many of us are familiar with. Also, according to the American Council on Exercise, andropause affects men over the age of 30, causing them to produce less testosterone. So while this is true, there are a number of things we can do to raise our testosterone levels, including, look at this list, high intensity interval training, multiple set resistance training, weightlifting to the point of fatigue, and getting adequate sleep. Well, the first thing that I notice about this list is these are things that I used to do when I was younger, right? I used to enjoy getting adequate sleep until, well, fill in the blank. Or that's right, I used to do high intensity interval training back when I was, again, fill in the blank. The thing to remember is that making an investment in our health is a good investment. Oftentimes, this investment is made with our most precious commodity. That's right, time. It's important that we take time to get adequate sleep. We take time to engage in some multiple set resistance training. And guess what? Multiple set resistance training, it means 2 sets or more. We could even put some dumbbells out, set aside a little time in our workday to get at least 2 sets of chest on, say, Monday, and 2 sets of chest or 2 sets of back on Tuesday, and so on and so forth. And if we want an added boost to our testosterone, we can make sure that we lift to the point of fatigue on each of those sets on each of those days. We can also take the time to enjoy some high intensity interval training. And remember, intensity is based on the effect it has on our bodies. For example, running drills at practice may have been intervals for me when I was on a sports team, whereas today, intervals may be accomplished by attending a virtual exercise class or adding intervals to my next walk, bike ride, or bout on the rowing machine. As we know, the only constant in life is change. So as our bodies change, our schedules change, our circumstances change, let's continue to strategize ways to build healthy habits into our day, including taking the time to care for ourselves. Here we have some sources for further learning. I encourage you to check all of these out, and I would like to thank you so much for joining me today.